Hello, everyone. Welcome to the Reproduction Specialty Group educational Zoom meeting on endemic diseases in the U.S. Small ruminant population. I want to welcome everyone here today. My name is Doug Edge, and we have with us two of our doctors. One, our founder, Dr. Tad Thompson, the CEO of RSG, is with us this evening, along with Dr. Scott Flanagan. Dr. Scott Flanagan is our breeding services team lead and member of our executive team at RSG and is based in Ballinger, Texas, at our breeding center down there. And I will turn it over to them to present today's topic to you.
Yeah, thanks, Doug. Thanks for everybody tuning in tonight and spending some time with us. Trying to advance my picture. There it is. There's Dr. Scott. Um, so just a really quick disclaimer as we get started. This is not an all-inclusive disease discussion. There's an awful lot of information that we will not be able to cover tonight. The goals is really just to kind of cover some less well-known diseases, also spend some time on some of those that are maybe more highly impactful that you've not heard of or thought of in the past. And then, and most importantly, we're going to touch on these at a very high level. So there's a lot of details that we're not going to be able to get into just based on time for tonight. Dr. Scott and I were joking around earlier, and we were looking at this slide deck and saying this was an entire semester of lectures going through vet school. So we're going to cram an entire semester into 1 hour. So put some questions in the chat and we'll try to answer them as we go to the best of our ability. So here's a quick list of some things we're not going to get covered. We can sure follow back up on those if there's interest in them. But here's what we're really going to kind of focus on tonight. Is going to be contagious lymphadenitis. We're going to touch on brucellosis, Johne's disease, OPP, and CAE. A little bit on Cache Valley, blue tongue. We're going to bring up some sinus tumors that are probably less well known. Also, border disease, Q fever, and New World screwworm. So why are we covering these, Dr. Scott?
Well, first, I'm so glad to be here, and I think it's going to be a good hour for us to get together. And this is just the start of a conversation. So I think certainly if we have any questions or anything, put them in the chat. And hopefully we'll have more information on our website as we finish this that you'll be able to refer to. But the why is I think the really good question tonight. And I think the best way to describe that, I've been part of the sheep industry as a young boy in the 70s all the way up till now, 45 to 50 years. And as an industry, the standard has always been in regards to disease screening and testing. It's been a very reactive approach. If we have a disease outbreak, if we have a bad outbreak in infertility or something along those lines, then it's almost like, okay, well, now we'll get into this disease screening and see what's going on. And as we've seen our world evolve and the idea of using frozen and fresh semen movement around the country, as we see an increase in exports of semen around the world, as we see some of these diseases begin to increase in their prevalence and build up in our environment, I think here at RSG, we're beginning to see the need to be more proactive in our approach. Where we're actually screening for some of these tests, where we're actually educating on some of these things that may not be as well known out there and bringing them in the light of day, so to speak, so that we can begin to address them and really on an industry level be able to improve the husbandry practices of the sheep and goat industry. And that's pretty exciting. So that's kind of the why behind tonight. And like I said, it's the beginning of a conversation. So we're excited about that. One of the things that we have to think about as we move to this next slide and this next thought is if we're going to be talking about screening tests and whatnot in relation to these diseases, and we hear these terms like sensitivity and specificity in regards to these tests, what does that actually mean? Just nuts and bolts from a producer. what does it mean if a test is more sensitive? Obviously we want everything to be 100% sensitive and 100% have 100% specificity, but they're not all going to have that. So how can we make good decisions? So number one, when we think of the term sensitivity in regards to tests, the best way to think about that is we want as few false negatives as possible. In other words, we have a high degree of reliability that that test is going to catch or is going to screen for that test that we're asking it to test for. So the higher the sensitivity means that we're not going to see those false negatives come out where the animal actually has the disease, but it doesn't test as positive. So that's what sensitivity means. And it's important, particularly in the screening aspect, because if we're screening for tests, we want as high of sensitivity as we can get. When we switch over to the term specificity, then that is more looking at the number or the decreasing the number of false positives. In other words, that if we have a high degree of specificity, we have a great deal of confidence that that particular test is truly going to be positive. And so we use this test. If we use the test with high sensitivity for screening, the tests with high specificity are the ones that we use for diagnosis in many cases. Of course, obviously, if they have both, that's even better. But just to kind of understand those terms, I think is important as we get into all of these different diseases. So let's start with our first disease, caseous lymphadenitis. I think this is probably one that most folks have at least some degree of familiarity with. You've heard the term CL lesions or CLA lesions. It's caused by a bacteria called Corynebacterium pseudotuberculosis. So it is a bacterial disease. It's something that, down here in the South, in Texas, we see it a great deal. Almost on a daily basis, we're exposed to CL lesions. So it is something that's very prevalent in the sheep and goat industry, and it's something that can have some far-ranging effects. So let's talk a little bit about it. Let's go to our next slide. This is not a reportable disease. So as a result, the true prevalence is largely unknown. We know that it has a global distribution, and I would say largely that this test probably goes underreported. Just because it's so prevalent, it's just become kind of normal for most folks. But it is something that is an extremely important disease because it does have a great economic impact. Now, how is it spread? It's primarily spread through animal contact. So the pus from these lesions, which are essentially, it looks like cheesy peanut butter. It's pretty ugly stuff if you cut it open. Usually you see these knots around the head and neck. That's the most common place. But as we go through this, you'll see that there can be other places as well. But we see it where we get contamination from the pus itself in the environment. Now, that contamination can be brought in a number of different ways. It can come in through equipment, through our docking equipment, dirty needles, when we're shearing, using those really sharp blades, and it cuts a furrow into the skin. It can introduce the bacteria. We also see it come in through fomites, which a fomite is an inanimate object that can have the bacteria on it that the sheep or goat can rub up onto and cause it. We also see some environmental causes like mesquite thorns, cactus spines, grass awns like threon and speargrass, needlegrass. Those can also introduce the bacteria under the skin and begin to cause the abscess as well. There's two different forms. There's a local, where that's just the local abscess that you see. And then there's the disseminated form, where the bacteria can actually get into the lymphatic system and spread to different parts of the body. We've seen instances where the abdomen or the chest is completely full of these abscesses, and it can cause various forms of death depending on where the abscesses are located. Go ahead and switch to the next one there. So what do we do about this? Well, primarily the approaches that we have are antimicrobial therapy, which has not been shown to be particularly helpful. Um, Even with things, some of the newer generation antibiotics like Draxxin in very high doses, we found that it just doesn't do a good job of killing this bacteria because basically we can't get enough of the drug into the center of those pus pockets to completely eliminate the organism. So as a result, antimicrobial therapy might be somewhat helpful, but it's never going to cure an animal with these CO lesions. On the local lesions, surgical intervention is good. You can lance and drain and flush with a antiseptic product such as betadine or chlorhexidine. Usually you have to continue to flush multiple times until the lesion begins to dry up. That's probably the way that we treat the individual abscesses. We have to be very careful though, because every time we lance those abscess and expose that pus material to the environment, it has the potential to get into your environment and cause a problem. So one of the things that we have to be real careful with is environmental control. The other kind of an old way of treating it is using small amounts of formalin, usually 10% formalin, injected into the abscess, which helps is kind of cauterize the pocket where the abscess is. That's another form of treatment for these local abscesses. Again, it's not the best form of treatment. Probably surgical excision and flushing is the best. And then, of course, the vaccines. Now, the problem with the vaccines is they're sort of on and off the market, and their ability to actually get you an immune response that is protective is not as consistent as we would like. Let's just put it that way. So what do we do? Well, one of the things we can do, particularly in cases where we have it in its more severe disseminated form, is we can actually cull infected animals from the herd or the flock. Or if we have a chronically infected animal, we can remove them from the flock to keep them from continually spewing the Corynebacterium bacteria into the environment. We can also sanitize our equipment, make sure that we use fresh needles when we do our injections, quarantine animals that have the abscesses and monitor them regularly. All those things are part and parcel in controlling this very difficult disease. In terms of diagnosis, the gold standard is culturing, but quite frankly, the Corynebacterium is not very cooperative. It doesn't like to grow in a petri dish. And so even though the bacterial culture is very good at confirming the diagnosis, trying to get it to grow is not very good. What can be helpful is PCR testing. PCR stands for polymerase chain reaction. It's a way of looking for the RNA that's in the organism, and it can help. It can do a good job of detecting the organism. Serology, which is looking for antibodies, has a good specificity and a fair sensitivity. It's not as reliable, and it's used best in a case where you're trying to screen your herd for antibodies to this organism. So there are some limitations to the serological testing. The main thing is this is an unreportable disease. It's highly contagious. There's not really a cure. And we have some limitations in terms of diagnosis. So, the take home is being vigilant, treating the abscesses when we can, culling animals when it's appropriate, quarantining animals and keeping them away from the pathogen as much as we can, limiting through good husbandry practices any chance that we could get a iatrogenic or where we cause the infection by using dirty needles and things like that. Okay, we'll go on. I know this is a lot of information, and I probably took too much time already on the first one, but the next one is brucellosis in sheep and goats. This is one that you've probably heard of a lot. Anybody who's moved a buck across state lines that's over 6 months of age is had to have this test done. It is something that can sometimes be very nuanced in terms of diagnosis, just like some of these other diseases. One thing we often will see in bucks, and then the picture that we just saw indicated that, is if you palpate the testicles, you see the testicle on the right. The tail of the epididymis is enlarged and ropey. If you were to palpate that, and that can be one indication that brucellosis might be at play there. So that's the reason that picture is in there. But moving on, there's the primary causes that we see for sheep and goats are brucellosis melitensis, which is primarily associated with goats, and then brucellosis ovis, which is sheep. There's also brucellosis abortus, or Brucella abortus, excuse me, which is the one we see in cattle that can occasionally be infective to sheep or goats. So those are the organisms that we deal with. Abortions, or particularly late pregnancy in sheep and in goats, are very common. Retained placentas, testicular swelling, like I had mentioned, enlargement and swelling of the tail of the epididymis, mastitis, and even sometimes lameness are all clinical signs that we can see, as well as infertility in rams. So it is one of those diseases that may not be particularly common, but when you do have it, it is a problem. There's no federal program for this in sheep and goats. There's been a very successful program in cattle that most of you are aware of. We've been essentially brucellosis free since 2009, except for an area around Yellowstone where it's in the bison and in the elk in that area. But there is a USDA indemnity program. So if you have livestock loss where you have to put one down due to brucellosis, there is some way to get some help with that. It is a very difficult disease to deal with, as we'll see. Primary transmission is through direct contact with blood, placenta, fetuses, secretions like that. Talked about, so it can be affect people. So we have to be very in birth products. It can also be shed through the semen, which is a very important aspect when we're thinking about movement of semen, selling semen, things along those lines. So there's a lot of ways that it can be transmitted. The primary management approach to this is culling, and because there's not really a good treatment for it in livestock. Humans, they'll put you on tetracycline called doxycycline, but it is not effective in animals. Testing wise, the ELISA test is the test of choice. It does a good job. You can see it has very high sensitivity and specificity. Most veterinarians know how to go through this process with a blood draw, so it's something that's fairly common, and it is recommended. Prevention. If you can maintain a closed herd, that's not always possible, obviously, but that can keep brucella from coming in. Test and cull any animal that is seen to be positive. We talked about all of the birthing fluids being potentially infective, cleaning those areas up. That's just a good practice in general. Wearing protective equipment when handling from the zoonosis standpoint. Obviously pasteurizing milk for dairy goats and whatnot. And then when we think about if we bring a new animal in, we need to quarantine that animal, test it, and don't let it enter into your flock until you know that it's negative. So biosecurity is extremely important with brucella. All righty. This is a very big, obviously RSG is, this is an area that we're particularly sensitive to, but both fresh and frozen semen can transmit the brucella organism. So it is something that's highly recommended to test, before, you sell semen or move semen, either frozen or fresh. So just think about that as we move forward. I think, as we go through in terms of recommendations, that's definitely an area that I think as an industry we could all improve on. Regular serologic testing for these high value animals is always a good idea. So, in a nutshell, that'll get us through the brucella aspect. Again, key takeaways: testing your sires. It can be transmitted through frozen semen. There's no program that's regulating it. ELISA is the test of choice, and there's no treatment. So, testing and culling animals is the number one way to get rid of it.
Okay, we'll jump into a little discussion here around a disease called Johne's disease. Johne's disease would have been predominantly looked at in the cattle world of because of the impact in our dairy milk we drink and the beef we eat. But the causative agent is still the same. It's a Mycobacterium avium subspecies paratuberculosis. So it's the same bacteria that causes Johne's in cattle, sheep, goats. And basically, to simplify what it does is once the bacteria gets into the intestinal tract, it kind of creates a chronic inflammation of the bowel. And so the chronic inflammation essentially causes a thickening of the lining, which decreases the animal's ability to digest and absorb its nutrients. And so it's primarily transmitted through the fecal oral route. And so if it's shed into the environment from the feces of one animal, and particularly in the first year of life, that's when the young stock would pick it up and it would enter into the GI tract. As an adult, when I was having this conversation with one of our USDA vets around it as an adult, they're much more resistant to contracting the infection. And so, if there was an entire pile of Johne's infected feces on the ground and a mature animal ate all of it, then they might pick up the infection. But for the most part, they pass it through. So it's typically picked up in the animals when they're young. I thought this was a pretty compelling set of statistics here. So there's 68% of the U.S. dairy herds have at least one positive cow. So 68% of all dairy herds in the U.S. have at least one positive cow. So that's a pretty significant understanding of what the prevalence of the Johne's bacteria is in the environment and in the U.S. And so, when you think about any of these situations where small ruminants are grazing behind cattle or the exposure of those, if there's through the sale barns or through hauling on trailers, there certainly is some risk that bacteria could be picked up throughout exposures that way on different facilities. So it's truly endemic throughout the United States and has a significant economic loss, particularly in the cattle industry. Testing is a little more tricky. So probably the gold standard would be doing the fecal culture of this bacteria, but it takes 8 weeks plus to grow that bacteria in the lab. There are fecal PCRs. And so the antibody testing is looking for the immune reaction within the animal. And so when you pull blood from that animal, the antibodies that are in the blood against the bacteria is what the ELISA test would be looking for. It's very fast and it's very inexpensive, but there is some, it's a low sensitivity. So as Dr. Scott talked about sensitivity earlier, 60 to 75% of the animals could be have an infection, but then test negative with it. Now, if that test is repeated, then the confidence of that test can go up. So one single test that says negative does not create enough confidence to say that the animal is negative until you do at least some repeated tests with that. And so, like if the animal is positive but not shedding at the time, only about 15% of those will be picked up as positives versus a high shutter, 75% of those would be picked up as well. So it's a tricky one to test for and have certain confidence that that it is accurate. So key takeaways on Yonis. Biosecurity is very, very important. There is no cure. Uh, Testing has some significant limitations, so being cautious on how you interpret a test is very important on that. And then just kind of knowing your herd status and understanding where those animals are at. As we move on to OPP and CAE, these are the small ruminant lentiviruses that we will cover. And so this is probably one that a lot of us have heard or know more about. So OPP, and that's not other people's problems. For those of you who grew up in the 80s and 90s, it is ovine progressive pneumonia. And that is the one we're probably most familiar with. And then in the goat world, CAE, so Cape Ryan arthritis encephalitis. So they're both lentiviruses. It's just how they impact the species is different. So they both can cause similar issues with respiratory disease or hard udders. And predominantly, the main reason for that is if you look at so histopathology or histopath is the microscopic look at a structure. And so if you look at the structures in the lung, it's an alveolar system. If you look at the systems in the mammary glands, they're also alveolar system. And so that's where we get hard bags as well as respiratory or lung issues in both species. But one of the significant differentiators in young stock and goats is having these neurologic kids. And so maybe 1 to 3 months old, you could end up with these young goats that start to have some neurologic issues. Initially, you might look at it and think that it's, polio or something like that going on. However, we need to rule out CAE in that. And there is a seroconversion component to that we need to keep in mind. And so I had a case earlier this year that a client brought in a young goat. We reportedly from a 100% clean herd of goats that had all been tested. So this particular kid was a triplet and had two normal siblings. He was neurologic. Mom had been purchased that year and tested negative. But as a result, her negative test, she was actually a positive carrier, and the other two siblings, which were clinically normal, tested positive for CAE as well. So again, some cautionary components to how we interpret tests and then the repeatability of it. So statistically, 48% of all sheep flocks in the U.S. Have some infected animals in it, and approximately 30% of the goat population. But interestingly enough, it was 80% of the goat population just a few years ago would have been infected. So the goat industry has done a great job of addressing that, and especially in the dairy goat industry. However, it is endemic throughout the U.S. And would go significantly underdiagnosed because of these, essentially poor testing regulations with that. From a testing standpoint, it's recommended to do the serology with an ELISA test. Excuse me. Excuse me. So the ELISA test is what we would most commonly use. This is a situation where the animals must be 6 to 9 months old to one, avoid the maternal antibody interference, but then also to make sure so in the situation we dealt with earlier this year, that they've had time for their immune system to set up and have the antibodies there that we're gonna be able to look for. Interestingly enough, some of the chlamydia vaccines can maybe affect results in that. That was something that I read here recently. that we need to kind of look into and learn more about. But when it comes to that serology test, it is in both sheep and goats. That's a high sensitivity and high specificity. So that is that's very positive test, a very good test. The things, the limitations there we have to remember is have those animals seroconverted. And so what that means is they can be exposed and they can be infected. However, if their immune system hasn't had time to do the complete processing of that viral infection, it may not yet show up in the blood serum. So that's what seroconversion would relate to. Again, we talked about the young animals, and then antibodies can wax and wane a little bit. So that's where occasionally that repeated test gives us increased confidence in the accuracy of that test. And I think with any of the tests, we need to remember that any test that we do is a test at that time. So it's a snapshot in time, may or may not change as time goes on. This is mostly transmitted horizontally. So respiratory aerosolization or nose-to-nose contact can be one of the main primary modes of transmission. So again, commingling or co-mixing, bringing in new animals before we know what their health status would be, things like that are a high risk. You can also have the vertical transmission, which would be essentially milk to baby. There is some evidence of in utero transmission, which would be more of that vertical kind of transmission, and then obviously blood contact. And then the one concerning thing from the reproduction company standpoint would be potentially found in semen to be transmitted. So those are the areas we'd be kind of cautious and aware of. So it's endemic in the United States. The ELISA test is a good test and is the gold standard for screening of these animals. Unfortunately, there is no cure or vaccine that would be available. At this time, we'll see if Dr. Scott, you want to talk a little bit about Cache Valley virus?
Sure. Cache Valley virus is there's some that may not have heard of it, but it is an extremely impactful virus that we deal with here in the United States. It is again a virus that we see in North America. It's what we call an RNA virus. It's endemic to both United States and our neighbors to the north and south. The one of the main things to think about when we think about Cache Valley, if you can go ahead and advance that next slide, Dr. Tad, is that it is the primary vector is a mosquito. So we have to think about that in regards to transmission and when we're going to see these mosquitoes feeding and things along those lines. You get a mosquito bite, which causes a viremia, which then can be passed in through the placenta and cause damage to the fetus. There's not really a direct animal-to-animal transmission. It's the mosquito that does the work there. When we think about Cache Valley, there's a tremendous amount of industry damage that it does. It's the most economically important virus that we have in our sheep industry. It causes a great deal of reproductive losses, particularly in naive herds or naive animals that have not been exposed to it, and it can be devastating. Seroprevalence in sheep is 64.6%. Positive fetal samples, 45%. In the case of abortion storm, 30%. So it is an extremely important, and the first 50 days are probably the most important as we think about the viral transmission. Let's go to the next slide. So in the first 28 days, what we'll see if the virus affects the fetus, we'll see embryonic death and resorption. So this is a situation where maybe for what we see, it looks like an animal is not breeding up well. Well, with Cache Valley, it's quite possible that fetus died and we didn't know it. So that's what happens in the first 28 days. From days 28 to 48, that's a critical period, because if the fetus is infected during that period of time, that's when you start getting the congenital defects that we see, that we typically think of when we think about Cache Valley. Where we see joint contractures or arthrogryposis, scoliosis, hydrocephalus. We see changes in the skull, cerebellar hypoplasia. We see a whole bunch of things in the fetus. Interestingly, and one of the maddening things about that is that the dams are asymptomatic. We don't see anything. There's rapid viral clearance within 1 to 3 days. So the virus comes in, it's introduced by the mosquito, and it's out of the dam or the female very quickly. So as a result, that makes diagnosis through the maternal side extremely difficult. So then the question is, how do we diagnose these? Well, the best way to diagnose Cache Valley is sending in the fetus so that they can do serologic testing by taking samples of the blood or pleural fluid or fluid in the lungs or the peritoneal cavity in the abdomen, so that they can do virus neutralization assays, which is the gold standard. So extremely important that we try to do our testing there. We can do PCR testing with these guys, but again, we have limited success because PCR testing is looking for the actual virus itself. And if it's cleared that quickly, then a lot of times you'll miss that window where the PCR test would come in positive. So that's just an important aspect that we need to remember on that. There's no vaccine available, so we really have to do things with prevention in mind. So breeding timing is important. So think about when mosquitoes are the most prevalent in your area of the country, and try to avoid at least the first 50 days of gestation during that period of time. So we need to think about that. Some other things that we can do from a prevention standpoint is manage the air velocity. And we're going to talk about that in more detail later. But if you think about a mosquito flying, if the wind's blowing, you don't have a mosquito problem. So in a case where you have a barn situation, if you can increase the air velocity with fans or whatnot, a lot of times you can decrease the ability for those mosquitoes to actually fly and feed. The other thing that does is we know that mosquitoes are attracted to animals based on the CO2 emissions. So that carbon dioxide in the air is where they want to go. And if you're dispersing that with a fan, it confuses the mosquito and they won't find their host quite as easily. And then, of course, the third thing is if there are ways that we can control the vector through insecticides and whatnot, that's helpful. Also, during this time when these sheep are the most vulnerable for infection, if we can make sure that they have enough wool, that the mosquitoes can't bite through the wool. So our shearing time can also be important. If we shear at least 30 to 45 days before we turn the bucks in, that wool is going to be of a length where it makes it more difficult for those mosquitoes to get through it and actually, feed and transmit the disease. Pour on insecticides, cedar insert can be helpful. So those are some other things that we can do. Obviously, anything we can do to remove standing water, things where those mosquito larvae can exist and then, larvate into adult mosquitoes is a good idea. All right, let's go on to the next one. So again, key takeaways, prevention is key. We want to make sure that we try to breed at the right time. We want to manage our airflow when we can. We want to be aggressive at vector control. The reality of it is the more we can do in regards to prevention, the better off we're going to be. This is a disease, again, where there's no cure. These viral diseases can be very tricky. And so, knowing your environment, knowing when there's the potential for a problem, knowing if you're at high risk. I have a client here that has their property is along a riverfront, and even during times when we don't see a lot of rain, they have a problem, whereas the rest of this area, which is typically a little more arid and dry, doesn't have a problem with catch valley. So again, if you're in an area where there's a lot of water, standing water, or water due to a tributary or something along those lines, you're going to be at a higher risk. And so these management things that you can do for prevention are extremely important. All right. Let's move on to another virus that has a great deal of economic importance. This is one that's we've known about for a long time. And it's another one of those that does millions of dollars worth of damage to the livestock industry, particularly the sheep and goat industry. So again, blue tongue is a virus. It's an orbovirus. There's a whole bunch of different recognized serotypes, which we see globally, but we also see here in the United States as well. So the difficulty with that is, since there's not a whole lot of cross immunity between those, sometimes finding the right serovar, which we'll talk about later in our vaccine, can be problematic. The virus does its damage by messing with the vascular endothelium. And so as a result, it causes swelling, hemorrhage, edema, tissue necrosis. So, we see, from clinical signs, we may see sheep that have a swollen head, the classic purplish blue tongue, swelling there. Here recently, I saw some sheep that just had swollen ears and an extremely high fever. So these animals are very, very that they feel terrible. They're extremely debilitated during this period of time. The mortality ranges from 2 to 90%. Goats seem to have a little bit better time with blue tongue than sheep, although they can still be affected in the same ways. Usually the symptoms are not as severe. Fine wool and mutton breeds are especially vulnerable. Let's go on to the next slide. Again, the primary vector, whereas with Catch Valley, it was mosquitoes. In blue tongue, it's culicoides biting midges, no-see-ums. That's what some people have called them here in North America. But it's a biting midge that causes the transmission of the organism. Again, it's not, except in rare cases, contagious animal to animal. There is one serovar in goats where there was direct contact, but by and large, with blue tongue, you see it through the biting midges, but they can also transmit it venereally through semen. So that's another important thing when we think about, frozen and fresh semen. It can go transplacenally, obviously, from the dam to the fetus, and it can cause deformities and abortions. And then you can also, like a lot of these blood-borne, fluid-borne entities, you can get a mechanical transmission through dirty needles or surgical equipment that is passed from one to the next. There may also be a small role in other insects, species that can bite and suck blood. So ticks may also play a minor role as well in regards to transmission. So moving on to the prevalence in the United States, again, we see this disease causing $125 million worth of damage annually. So it is a big deal. We look at the serotypes. There's a number of serotypes that we've seen. And we've seen this in 20 plus states. And quite frankly, it's much greater than that. The others probably just haven't tested enough to see the blue tongue organism. It's very prevalent in the Midwest, down here in Texas, and in both coasts, or especially the West Coast. So we see blue tongue quite a bit, and it's a devastating disease in some instances. Diagnosis. Well, first, I'd mentioned the clinical signs, um, fever, like I said, and then all of the edema and swelling around the head and the tongue and whatnot. Um, some differential diagnosis or other things it could be. We don't have foot and mouth disease here in the United States. However, that is something that would look very similar. One thing that we do have in the United States is this epizoic hemorrhagic disease, which is something that's normally seen in our deer species. It can sometimes cross react into our small ruminants. That can also be something that can cause very similar symptoms, as well as photosensitization, which is something that we see particularly in the summer, where the chlorophyll causes a swelling of the head when they eat certain plants. So, so those are some of the other things that will look similar. Um, in regards to diagnosis, the ELISA antibody test is a good screening test in regards to serology. As far as the test that probably does the best job of looking for the organism, again, your PCR test does your best for that. The polymerase chain reaction is looking for that RNA of the organism itself, and it can also help identify the exact serotype that we're dealing with, which is extremely important because when we talk about prevention in vaccination, um, we have to get this serotype right. On the next slide, you'll see that that we if we have it, because there's not a lot of cross protection between the serotypes, we have to make sure that the serotype we're using is actually going to be the one that we're dealing with. And so working with your local veterinarian in the area can be helpful. Many times the vaccines, because of that, are not always readily available. And so that can be difficult. And one other important aspect of this is um, that you don't want to vaccinate during pregnancy because that can cause some teratogenesis or damage to the fetus in utero. So we have to be very careful with that. Vector control is an important aspect of what we try to do from a preventative standpoint. So again, some of the things we talked about with mosquito control, we want to watch those areas where there's wet pastures, where the midges are really breeding. We can use our air velocity to minimize the ability for these biting insects to actually make it and transmit the virus. So those are extremely important. And then also think about their feeding. They tend to want to peak during dusk and early evening, very similar to mosquitoes. And so being mindful that that's when they're going to do their thing and providing preventative measures at that time is going to be very helpful. So what do we do in terms of treatment? Again, I've dealt with blue tongue quite a bit. The main thing is you're treating symptoms. These animals are very highly affected. They have high fevers. They're very painful. So NSAIDs can be very helpful. Banamine, meloxicam, things along those lines to help with the swelling and the fever. Antibiotics can be used. They won't destroy the virus, but they can be helpful for secondary infection. These animals are miserable. They need to be kept in the shade. They need to be kept under a fan. So we have to be very careful, with them because if we stress them too much, it can, cause them to die. Reproductive concerns. Blue tongue can cross the placenta. It can cause abortions and stillbirth, congenital defects. We can also see lambs very similar to Catch Valley, where they can have deformities of the head. We can see blindness, and you can have venereal transmission via the semen and in viremic males. So that's another one of those things we have to be careful with when we're shipping semen. And then, of course, as I mentioned before, we want to vaccinate before breeding season because during pregnancy, it can definitely cause a problem with the fetuses. So again, key takeaways: work with your veterinarian, your local veterinarian, to identify the serotype that you may be dealing with. Invest in midge control. Be smart about it. Avoid, standing water where they'll breed. You can test breeding stock before introduction. Blue tongue does transmit venereally and transplacenally. You want to time your vaccinations before breeding season, again, because of the teratogenic effects in pregnancy. And it's a disease that we have to take seriously because it is one that can cause a great deal of damage. As I mentioned earlier on several occasions, when we're talking about mosquito and midge deterrence, air velocity can be extremely important. And so when we think about that, we can see some initial deterrence when we see an air velocity of 0.3 meters per second. But really, to get near total prevention, we need 2.5 meters per second. That's about 5.5 miles per hour in terms of wind velocity, but that will knock those insects down to where they cannot locate the animals and um, they cannot zero in on that CO2 plume to find the host. So that's extremely important. So as we think about that practically, um, when you're designing your facility, what's going to work best in order to diminish the chances for these insects to feed and move the disease from one animal to the other. If we can use fans that have the high velocity, like a high velocity industrial fans or even box fans, things along those lines that can move that air at least 5.5 miles per hour, that will get the job done. Um, I will caution you. The ceiling fans, even those big ones, and I had to learn this the hard way because I installed one of the quote unquote big ass fans in a barn of ours, and I found that it did not provide the air velocity that I needed for either suppression of mosquitoes and midges or fly suppression, because fly suppression is also important because that also causes a great deal of economic loss. So I would suggest that if you're trying to design a barn to where you can get these velocities on target and doing what they need to do, that you use one of these products that has a high air velocity. Um, if you want really good coverage where even the edges of where the sheep are going to be kept will have that minimum of 5.5 mile per hour air velocity to keep those insects from being able to feed. So it's an important aspect, and I can't stress it enough. The other thing, as we mentioned, is be mindful of the activity patterns in the season. Our summer months are going to be the peak for these biting insects. So, depending on the part of the country you're in at the time, some areas have a longer season than others just because they have warmer weather. And then, of course, the dawn to dusk feeding time is the primary time. How many times have you been out trying to have a barbecue in the evening and the mosquitoes are covering you up? Well, they're doing the same thing to our sheep and goats. So we need to be very, very cognizant of that and provide, those deterrents in place so that doesn't happen during those times of day. So in a nutshell, this simple idea of recognizing the feeding pattern of these insects and providing enough airflow to keep them from feeding can sometimes be your most important preventative measures.
All right. Thank you, Dr. Scott. We're going to shift gears a little bit here to sinus tumors in sheep and goats. And so that is enzootic nasal adenocarcinomas. And this particular one has kind of surfaced continuously each year. And so I get, from the veterinary standpoint, we'll get phone calls or questions around someone having an animal that's increased breathing noise, so they kind of hear this wheezing sound of the animal or a lot of nasal drainage. And, the common question comes up is, are these nasal bots, but they've been dewormed? And so as we have continued to explore those, we're learning more and more about the sinus tumors that we're developing. Initially, there was a thought that they may be connected to the same lentiviruses that were causing OPP, but they are not related. And so these are a different virus altogether, and they are a a cancer-causing virus, where the lentiviruses of OPP and CAE are not, they do not create a tumor to occur, and so that's why this is a completely different disease. So these are the published statistics. Um, I think these are probably a little bit underrated. It's based on the number of phone calls we get a year and presumable diagnosis, but I don't know that these animals are going to, a lot of times these animals die and are buried and are never confirmed those to be the diagnosis. But interestingly enough, this particular virus is confirmed in on all continents except Australia and New Zealand. And now obviously very common here in the US and other common areas of the world that we work in. So just wanted to make you aware of that. Clinical signs, as we talked about, a lot of times folks call and it's nasal discharge. It's some kind of a increased noise, respiratory distress. Maybe the animals aren't thriving as well. They're eating and drinking, but they're just losing weight. Sometimes you'll see a bulging of their eye or exophthalmos. That's where the tumor is putting pressure inside that sinus cavity and takes up space, and so then the eyeball starts to push out. On a rare occasion, I've seen where it starts to eat away at the bone of the skull, so you'll see some deformities there. But many times it ends up in a suffocating situation and uh, uh, um, unable to die, or they die from suffocation standpoint. So some of the diagnostic challenges, uh, again, I think a diagnosis is typically most confirmed clinically. Very little testing is done. There's no reliable blood test. The viruses typically cannot be cultured. And again, these animals clinically get to a certain point and then die. And so the number of those that actually get into imaging and looked at from a clinical standpoint is pretty low. So we've had several of these that have had surgical removal. I worked quite a bit with a veterinary surgeon at Purdue, our local university, and there was many of these animals that we would take in there and surgically remove and cauterize, and it can be done. It evacuates the tumor, frees that space up. However, these are very aggressive tumors, and we've had some that have returned as quickly as a month, and we've had some that maybe takes a year or two, but they inevitably do return and are going to cause the animal to die or need to be euthanized either way. So it's a really tough one. We say, okay, call affected animals. Obviously, if they're a high quality, high value animal, you're going to try to do what you can to salvage some genetics. Obviously, biosecurity, but again, it's a little one. It's a very hard one to screen to know about before you bring them in. One point we wanted to make is that the bighorn sheep tumors are reported, but they are not the same viral component to it. And so the animals, these bighorn sheep, were tested, and it ended up being other viral causes of within the bighorn sheep. So just to clarify that point tonight. Key takeaways: sheep and goats can both be affected by these sinus tumors. The reported flock and herd prevalences are low, but likely unreported because the animals develop the disease and die and aren't historically reported. Unfortunately, no vaccine, no treatments are available. So we just have to do our best to manage those situations. Okay. So we're going to spend a little bit of time talking about border disease. And this is kind of an interesting one that, border disease has, my impression, and I think Dr. Scott would agree with me on this, it was a bit of a kind of a novelty disease. Oh yeah, border disease is floating around out there. It's in the area, but it's not much of a doesn't have much of an impact. Uh, and then as you start to kind of research it and learn a little bit more about it, I think we've probably diagnosed that a number of times, just or missed it altogether. So if you look at the picture there, I mean, we've all had, many of us have had babies that kind of come out and look a little weird like that, and you just kind of write it off to something else. But what we want to talk about on this is border disease is a pestivirus, uh, viral infectious disease, and it's very closely related to the BVD virus, which is the bovine viral diarrhea, and then classical swine fever virus. And so those are viral diseases that affect other species. Obviously, it was first reported in 1959 in England and Wales. It was on that border between those two countries, and so that's the terminology border disease. Many people here in the U.S. would recognize it as fuzzy lamb disease or hairy shaker disease, something along those lines when these babies would be born. And importantly, the transmission is going to be from an infected animal to a non-infected animal, so animal to animal contact. It can go through the maternal system to the fetus through the placenta. But most importantly, we need to be aware that there is a potential semen transmission with it as well. So as we look at the clinical signs, again, these are some of the phone calls we get over the years. And so barren ewes or poor scanning rates, things like that, when presumably there's not a clear reason why, or abortions. And here in the last few years, because things like Cache Valley virus have become so much more prevalent, many times people just chalk it up to, looks like it could have been Cache Valley or something along those lines. And I think this is just kind of bringing to light that there are so many other things that could be causing those situations. And one of those potentially we need to have on our radar is the pesty virus that would be border disease. So again, could get abortions, stillborns, weak lambs, small lambs. We see that muscle tremors. That's where the shakiness comes into play. Abnormal hairy fleeces and skeletal abnormalities. In the adults, it's really, we may not see it. It's a little bit like Cache Valley in the sense that, in the adults, they may look completely clinically normal or healthy. And so it's not like they get sick or run a high fever or things of that nature. On the male side, we do see some fertility connections to it. And so we certainly could see that and probably need to be doing a better job of screening for that in some of our males. I think interestingly enough, we need to be aware of these persistently infected animals. And so again, these are the adults that have caught the infection, become viremic. They're persistently infected. They look normal, but they're shedding that virus. And so we just need to be very aware of that, particularly in the males. So if they're persistently infected, they're very likely going to be transmitting that virus through every ejaculate of semen. And unfortunately, it also survives the freezing and thawing process. And so frozen semen products from a persistently infected male, that virus can live while being frozen in that scenario. So we need to be, again, putting that on our radar. This was a really interesting study from 2019. So a set of lambs were transported, 1,700 lambs moved from Colorado to New York. And they were brought in, sheared, weaned, and over 300 lambs had died within the first few weeks. And as they started to look at it, they were finding they were all infected with border disease virus. Another study done in California showed a high prevalence of the disease. And so just kind of keep things moving. This really is our international export markets have evolved. And so more and more countries looking at the being able to purchase U.S. genetics to take to other parts of of the world, this awareness of, hey, we need to be testing for these diseases before they'll accept our U.S. genetics, kind of pushes it up to the top of the list. And to confirm, the transmission in semen, it was an interesting research study that looked at, there was a group of cows that were inseminated with infected frozen thawed semen, and 5 out of those five cows seroconverted. Again, 5 out of 5 is a small sample size, but it was 100% of that small sample size. And we do find that virus in the testicles and in those semen samples that we would take. So I did have a question a little bit ago on the chat about testing semen, and this is one of those that the virus isolation of the semen is unreliable. So the semen toxicity can kill the lab cultures, and so while the virus is still present and active in the ejaculate or in that frozen semen sample, once it gets into the lab, there's a toxicity that's created from the semen itself in the lab that affects the culture rate of it. So it's a hard one to test specifically from the frozen product. And again, this is one of those that, as you look at the data that's published, seroprevalence of 5 to 90% in sheep and 2 to 25% in goats. And so anytime you have numbers like that, it's like, well, they don't know. Like it's so variable that it's probably higher than we are aware of. Again, we've already talked about clinical signs. Just need to kind of reiterate the persistent infected animal and how that can really be impactful, specifically in the sheep. The interesting thing is in the goats that it's less of an issue in the goat industry because the fetal death rate is very, very high. It's nearly 100% of the infected goats to pass that on to a baby. And so very rare to have those persistently infected offspring on the goat side. Get my clicker to work. So key recommendations, if we could do some testing, particularly on our high value donors, as well as our sire, it's a fairly simple blood test that we could run for that. It would be a great screening approach in that pre-breeding season, especially with your sires, where you could be transmitting border disease virus through your entire herd or flock. And this goes back to the biosecurity piece, that quarantining all purchases. And so I think as an industry, that's probably one thing we're very, very lax on is our biosecurity stance and how we quarantine and isolate animals as they come in and particularly come into a population. But any movement, even if they're your animals that go out and they come back, there certainly should probably be some considerations around what do we need to screen them for as they come in to come back to our populations. Don't run. This was kind of interesting, separating cattle and sheep, so not to go back to the old cattle sheep controversies of the grazing years, but don't commingle cattle and sheep. That's a good way to cause some increased infections. So now we're going to move on to a disease that's actually kind of near and dear to Dr. Scott's heart. We'll talk a little bit about Q fever.
Well, yes, not by choice. So here recently, I got a severe headache and fever, chills, nausea. Just felt terrible. Of course, every disease does that, but this was worse. This was more than I'd ever experienced before in any other. And I'd gone through COVID back in the COVID days and things along flu and whatnot. And to make a long story short, after a week of this, I ended up going to my doctor because veterinarians always wait to the very last minute, and he went ahead and hospitalized me. And they did some testing and it was all negative for those other diseases, but I came back as a reactor to Q fever. So we're still going through the serologic testing part of Q fever, but I think this is a very appropriate time to talk about this. From the standpoint of Q fever is a very critical zoonotic disease. It's caused by Coxiella burnetii. It was actually first diagnosed in Queensland, Australia. That's why it's called Q fever for Queensland. And they actually have a vaccine in Australia for Q fever, which we don't have access to here in the United States. But it's an extremely important disease because it's so prevalent. If we think about prevalence rates, we're talking about 77 to 90% of U.S. dairy herds are infected. We can see it in all livestock species. It can cause abortion storms where you can get 65 to 81% death loss. It has, again, as I mentioned, a high zoonotic potential. And here recently, and this is an extremely important finding that is probably not widely known, is it's been confirmed that you can transmit it through semen and embryos, as well as what we have normally recognized Q fever to be transmitted through placental secretions and things along those lines. So there's a lot going on with Q fever right now that I think it's important for us to understand. When we look at we talked about cattle, dairy cattle, 77 to 90% infected, 7.8% in goats. And then on the side of the zoonotic part, 380,000 humans are diagnosed a year with Q fever. Q fever can also have some long-term consequences to your heart valves and things along those lines. So when we think about transmission routes, again, birth products are the highest. So placental secretions, during birthing, milk, but also we cannot forget airborne as well. When we think about these animals having lambs in a barn over a period of time, and that fecal material and hay and placenta is all kind of mashed together into this mat or dust, you can actually get this disease airborne and breathe it in and contract Q fever as well. So it's an extremely important disease from that standpoint. So always glove up when you're working with placental fluids and whatnot, and particularly if you're immune compromised and maybe otherwise, wearing a mask so that you're not breathing in a lot of dust is not a bad idea as well if you're working in the barn to help prevent that. But what we see in red there on transmission, semen and embryos have been confirmed that we can pass this bacteria on is an extremely important finding. And even in situations where we do a specific type of wash to try to clean those embryos off, it can still survive that. So this is a recent discovery, and it's something that here at RSG we're going to give some thought to in terms of how we need to think about this, A, because of its prevalence, but B, because of its ability to be transmitted through semen and with the embryos. It's something I think we need to really look at as an industry in terms of how we assess our testing protocols. So, I just want to emphasize that point and let you know that we may be looking at some different ways of approaching Q fever moving forward. So a couple of things in terms of problems when testing. There's no single reliable test. And we see this in both humans and our animal species. It's very easy to get false negatives because you can get intermittent shedding. And then also sometimes you have to seroconvert, which Dr. Tad described that to you, before the test can be positive. And so if an animal or a person hasn't seroconverted, then the test may show up as a false negative. So we have to take a multimodal testing strategy where we do serial sampling over time, determine whether an animal is positive or not. We have to do some testing of the herd so that we know if we're at high risk. And we have to be very vigilant because of the enhanced biosafety protocols that we have to ensure the safety of not only the people that work in livestock environments, but also when we think about the transport of embryos and semen to other animals and how that could potentially spread that Q fever infection, through those products. So this is an extremely important, I guess, topic that we need to wrestle with. Certainly, it's always been a zoonotic problem, but now it's a venereal problem. So it's something that it's on our radar. Let's just put it that way. I'll leave that there, and then the last thing that we'll talk about in terms of a potential an entity that could cause damage to livestock is our New World screwworm. Obviously, being down here in Texas, we probably are exposed to the information related to the New World screwworm a little more than maybe for those folks that may be further north. The good news is that it's not currently present in the United States. You may have heard recently that there was a human case to someone in the Northeast had traveled down into South America and contracted it and brought it back. And then here recently, like this week, an animal in Florida who was under quarantine because it had been shipped in from Argentina was found to have a screwworm larva. And of course, they treated it. Everything's going well. They feel like this is a self-contained situation. So good news, it's not here yet. But we do have a major concern still because it's probably within 100 to 200 miles of our southern border and is moving north rapidly. I can't understate, how devastating it could be if it did make it to the United States. It can turn into a problem very rapidly. We know that within 1 to 2 years in Central America, Nicaragua and Panama area, they went from 0 cases to 144,000 in just a few years. They've had 1,100 human cases confirmed since 2023 and even several deaths. So it is something that's extremely important for us to monitor. There's a couple of new things that we have moving forward, as far as the United States response to that. We're currently releasing 100 million sterile flies along the Texas border per day. We have a new, this again is brand new within the last 10 days. We have a new sterile fly dispersal center on our southern border. And by the end of 2027, we should have a $750 million facility that will be producing at least 300 million sterile flies per day here in the United States that we can use to, again, close off the border like we had previously done when we eradicated it from our borders. So I felt really good about our response. The next few years are probably going to be kind of wait and see. As we get into the spring and summer, I would expect those for the screwworm to be a little bit closer to our border, and it's possible we may see a few cases. But right now, I think we're in fairly good shape.
All right. Thanks, everybody. We're 20 minutes over the hour, so Dr. Scott and I apologize for taking a little longer tonight. But in summary, probably 4 main takeaways: biosecurity, making sure you're kind of quarantining your animals as they come into your herd or flock, and knowing what level your herd or flock is and what your testing requirements should be. That testing assessment is important. So really want to encourage being proactive, not reactive, to some of these testing requirements or testing technologies that are available to us. And then as we talked on facility management, those things can help prevent or reduce the exposure to some of those diseases that we covered here in the last hour. And just always remember, health standards are the fundamental basis of good animal production, and maintaining high health standards as well as good nutrition products. Health and nutrition are the cornerstones of any program. So Wanted to mention that. We do have a new production guide coming out, which takes a little closer look and breaking down the 365-day approach into phases of production and how you can help work to best manage those different phases of production. The production guide doesn't go specifically into the diseases we talked about. There's some quick references. We will have links up on the website to kind of I'm not going to say a one sheet, but a summary page of the diseases that we covered tonight. It's going to be it won't be tomorrow. It'll be a few days to get those put together, final and up on the site. But those will be available as soon as we can. This video recording will be posted on our YouTube page, and then I believe we are sending an email summary of the slides to all the participants of tonight's meeting. So appreciate everybody's attendance and spending your evening with us tonight. I know you all have other things that you could be doing, so I appreciate that. Dr. Scott, anything you want to say in closing?
No, well, just thank you for attending, and obviously, if you have questions in the future, let us be a resource to you, and be looking for these resources that we're going to be putting out through the website that you'll have access to.
Doug, do you want to close this out?
Right. Yeah, thanks everybody for attending. As Dr. Tad mentioned, a lot of these resources will be available at reprospecialty.com. That's our website under the resource tab. We already have a number of resources there, but the new production guide will be uploaded very soon to there, along with information on these diseases covered tonight. And then our RSG YouTube channel is where you can watch the entire playback of tonight's session. We'll have that uploaded within a couple of days to that channel there. So appreciate everybody's time. We do have more of these meetings coming up too. We have IVF topic around in vitro fertilization coming up, along with solar grazing and some information about our upcoming sire showcases in the West Coast and here in the Midwest. So looking forward to those. You can check out all those and sign up for those for free on our website as well. Have a great rest of your evening, everybody. Thanks for joining us.
Thank y'all.